Thank you for joining us for today's MaritzCX webinar, Cracking the Patient Experience Conundrum. I'm Melissa Harrod, and I'll be moderating today's event. With me today is our presenter, Jason Macedonia, Vice President, Patient Experience at MaritzCX. We're happy to have Jason with us, and I'll introduce him more formally in just a minute. Before we get started, I wanted to cover a few housekeeping items. This webcast is being recorded. You will receive a link to the recording within the next 24 hours. We will also have time at the end of the webcast for Q&A. If you have questions during the presentation, please type them into the question box on your screen. We'll get to as many of those questions as we can during the Q&A time. As mentioned, our presenter today is Jason Macedonia. Jason is Vice President of Patient Experience at MaritzCX, where he leads strategy, design, and administration of patient experience solutions. With a background in organizational development and experience measurement, this role complements his development of industry norm-disrupting capabilities using technology-enabled capture of insights to drive innovation, improve patient outcomes, strengthen employee engagement, and assess organizational culture. With 15-plus years of experience in healthcare before joining MaritzCX, Jason served as Senior Vice President, Strategy and Development at Avatar Solutions, an innovator in the patient experience space. Jason's responsibilities included executive oversight of prominent patient experience programs with organizations including Mayo Clinic, Kaiser Permanente, Dignity Health, and the University Health System Consortium. Jason has also advised healthcare leaders on statistical sampling, data presentation, compensation incentive models, healthcare and patient-centered survey design, survey administration, CMS CAHPS compliance protocols, HCAHPS reimbursement acceleration, and data-driven goal setting. He is a contributing member to the Barrow Institute Patient Experience Body of Knowledge and has presented at national conferences on innovations in patient experience measurement. And with that, Jason, I'm going to let you take it from here.
Melissa, thank you very much, and thanks for everyone today for taking time out of your day to join. I'm very excited to talk about the topic of cracking the patient experience conundrum, and I recognize that not everyone may agree that it is a conundrum, but nonetheless, we intend to get into some of the new technologies, some of the way in which we explore patient experience, better understand it, and take action against it. And before I begin, I just want to take a moment as we look at this scenic overlay of a hospital from an aerial view to say that our minds and our hearts are with anyone affected by Hurricane Dorian. I happen to live in Central Florida myself, and we were lucky not to have been impacted so greatly as the coast is and other areas. But if your organization, your hospital, your system, or friends or family are impacted, we are thinking about them. Today's agenda is going to cover a number of concepts, and we'll begin with patients as consumers. We'll talk about challenges that exist for current patient experience programs. We'll get into the patient journey. We'll discuss diagnosing, designing, and delivering differently and thinking in new ways about how we tackle patient experience and how we bring together some of the data and some of the capabilities we have for improvement. I'm going to highlight the importance of employees for a few minutes toward the end, and we'll close with effective dashboards and reports before we get into Q&A. Beginning first with patients as consumers. One of the things that we know is that the industry for many years has not necessarily embraced patients as consumers or customers of healthcare. Some organizations have looked at both sides of the coin, a patient experience being very humanistic, being very emotional, being very different than a purchase of a good or service in an industry. But others have looked at both sides and started to conceptualize the way that a patient does operate like a consumer and the impact that may have on experience, on decision-making, and ultimately on where they seek care. A number of things have been changing in the industry. First and foremost, patients today have greater choices and more means to determine choice than ever before. And those choices and the ability to make decisions have affected their expectations. One of the things that we know is that patient expectations are, in fact, a critical component. They're shaped in many ways, and they are often shaped before an initial experience is had with a particular healthcare organization. So for example, friends and family members having visited a nearby hospital in the community, or the media or social data can often impact one's perception of an organization and the care it provides. That may also impact a consumer's decision and ultimately their choice as a consumer. One of the other things we have at play is the multitude of interactions across the healthcare continuum and within healthcare organizations. Patients today are interacting with many more providers. They're coming and going for more tests, more treatment, different areas of a health system, including different physical areas where they might go to seek that treatment. And as they do, there are lots of new ways and opportunities to understand the impact of those experiences and those interactions. I also mentioned technology. Technology is being used more and more by consumers and by survey respondents as we think about collection of data to understand and contribute feedback. And lastly, community. The community and the way in which a healthcare organization serves it has changed even over the last couple of years in terms of how the organization is seen as a health resource, as a beacon for understanding treatment options, even wellness and well-being before patient needs are imminent. So we know that organizations cannot stick to the status quo. And as we move through today's presentation, I would challenge anyone listening in today to be thinking about ways you can take your patient experience program to the next level by embracing some of the new capabilities or some of the new technology, as well as a different lens of thinking about the patient as a consumer and as a person who has choice and makes decisions based on a multitude of experiences. Now, as we dig into the patient experience programs that exist today, we know there are a handful of very common program issues. One of the most common is that the survey itself, as we think about a patient survey, most often executed after care is provided, is very limited in what it can measure and very inflexible. That in part is due to the traditional nature of vendors in the space and their tools and technologies to be able to follow or have challenge in following the patient journey. And also in thinking about what we might ask patients and perhaps not having thought leadership about new concepts or ways we can dig deeper and better understand the experience across that journey. Speaking of journey, we know we have difficulties measuring the span of a patient journey. We even have difficulties understanding how it occurs for an individual patient or a group of patients. And so one's ability to look into the data, understand the way patients move through the health system, the way they select care, select treatment paths, and dynamically use information to create surveys along the way can help unlock the ability to follow that patient journey in a more robust way. We also often have disconnection of data, in particular siloed data between patient experience programs, operational data, HR and employee engagement data, which we know is very impactful on the outcome for patients, and revenue and other clinical information. And wouldn't it be nice to have one place where we could analyze that content, but be able to understand the influence, be able to understand the drivers across those different data points? We also know that often feedback is not shared with employees. And there are a couple of different flavors of this. One is that not every employee has the opportunity or knows the way in which they impact the patient experience. So we know that employees are regularly the ones to provide care, and each of them has a unique way in which they connect with the patient, but we don't often give them their slice of data, or they don't often have the ability to see their unique impact on that patient experience. Another flavor of this is that we don't necessarily include employees in the process. We don't take their voice, their decisions, their ideas and insights into the equation. And so we are masked and we're limited in what we can understand based on our expectations of a PX program and the way employees can deliver against it. We also know that oftentimes patients are also not informed about their feedback and the way in which it's used. And if your organization is ahead of the curve, then you are one that shares with your community the things that you have learned from the patient surveys and experience measurement, and you've shared with them actions that you've taken to make change. And in so doing, you get better participation and a better connection, better contributions from your patients and your community members in terms of what you understand. And lastly, an inability to customize the reporting. In particular, having to create one's own reports, organizations using analysts and PX leaders to design reports internally, update those reports, push them out, and manage the reporting process. And those things cause us to have to focus more on the operations side than the taking action side and actually improving the patient experience, which of course is what we all want to do. So as we dig deeper and we think about the concepts associated with quality, safety, and performance improvement, the things that we're constantly seeking to better understand and take action on, we begin with discovery. We need to be able to organize our survey and our strategy in the most robust way. We need to think about mechanisms to recover patient experience in the moment, include voice of employee, make sure our data is protected and secure along the way, and that we're leveraging benchmarks and tools to the best of our ability. As we combine that with the technology and the tools we have, we think about the ability to get deeper, to be able to ask more unique things, leverage technology to use branching logic within online surveys, leverage text analytics and more robust predictive models, and even case management to ensure that we follow these processes through and document exactly what happens within our organization and the preferred actions that we take. And lastly, following the best practices, understanding the different aspects of a patient journey, having holistic governance over the entire program, and thinking strategically about the point of views from patients, employees, as they relate to feedback and actions that we take. One of the things we've been thinking quite a lot about as MaritzCX has entered the healthcare space is to think about a strategy that isn't just patient survey related. It goes much deeper and it goes much broader to get into the concepts of reputation monitoring, patient assistance, the collection protocols and management, and of course the operational analysis. And as we peel back these layers, beginning with reputation monitoring, we're thinking not just again about a survey executed to a patient after they come, but we're thinking about it up front. In what ways do community members and patients seek information from us? In what way are they contributing via social media, social data about their experience or about a loved one's experience and journey? And how do we understand that data? Thinking about community outreach, in what ways does the medical center or health system survey the community, understand not just health assessment type needs, but what are the perceptions of the community about the organization? And in what ways might we embrace that feedback as part of a patient experience program? And in addition to that, thinking about benefactors. Most healthcare organizations rely very heavily and benefit very greatly from contributors, either organizations or individual benefactors. And in what way might we treat them a little bit differently or learn differently from that important group by leveraging technology and capabilities in a more robust way? Patient assistance gets into more real-time components. When a patient is viewing your organization's website for health information, in what way can you engage with them at that point, before they even become a patient, to make sure they're getting the information they need, make sure they understand the details around care treatment plans, and even just find the information that they're looking for through your website? Rounding, the process of real-time understanding of patient needs, cataloging the process of a round via nurses, via providers, and also employee rounds, leadership rounding, and being able to manage that within one system and one platform, one source of truth. Collection management being more of the components associated with a pure patient experience program. When we provide data files to a vendor, what is the output of those files? And in what way does the organization's leaders have a window into how are our data files and processes being handled? What metrics do we learn from them? Even generally, what analytics can we learn from our patient populations, and how can we use those variables differently in executing surveys and also on the results end to understand the outcomes. So a window into the collection process is very important. And finally, operational analysis, being able to customize reports, having the look and feel and dashboard visualizations of data that let you say, now that I see the big picture and I follow my organization's goals, what next and what now? And how can we dig deeper, understand more operationally what actions to take that are going to drive the needle? One other important aspect of this is data ownership. And we are mindful that there are many of you out there that may not have the ownership of your data as part of your patient experience program. And we believe holistically that the data is the organization's. It begins with the organization, and it ends with their action based on the data. And every way through that step, all aspects entail the organization owning their data, being able to use the technology provided by a vendor to be able to better understand, learn, grow, and make change. And so with that, we think about the patient journey, and we think about lots of different interactions, not to say that a patient goes through all of these, A, B, C, D, E, so on and so forth, but that there are different points in time and patients enter and exit the journey at different moments. And in what ways might we engage a patient differently on the front end when they're thinking about or they're researching care versus when they're in a waiting room or in the moment while they're with a loved one, if they're not themselves the patient, having just gone through a procedure or a process, and then going back out into the community and sharing their experience. So designing, diagnosing, and delivering really is an important concept as three critical steps in the process. And as we think about designing, we, as I mentioned, want to understand that journey. We want to create some flexibility in where we provide patients options to respond, and also how we can tailor those measures to reflect the unique experience of a patient. What that does is it gives us better data, it gives us more unique information to react to, and it doesn't overburden a particular patient or respondent. Diagnosing, connecting that patient view to our strategies, to operationally what we can do, of course, making sure that all of the right people have the right data, and that we're strategic in our actions and actually taking actions on the data. And then delivering, looking to the endpoints of how connected are we now to the patient care and to the patient community than we were before? To what extent is our patient base and our community loyal to our organization, and how has our reputation improved? And these are all things that we can design to measure and understand the outcomes from start to finish. Now, another of the challenges that we know exist in the patient experience space is the disconnect of processes and in particular of data. And when you think about some of the core elements of post-experience patient surveys, many of which are done by mail, but more and more moving to online and embracing certain technology, we think about rounding as a process and a different set of tools and capabilities with data that live in a different place. Provider and employee surveys and engagement type metrics that again are issued and typically reported in an adjacent place, not connected necessarily to our patient experience and other rounding type data. And then research and action tools. These are all typically very disconnected data sets. And even in the cases that a single vendor is the source of truth or the preferred partner to seek information, the reporting tools and the capabilities don't allow for the span of all of these data points. MaritzCX has conceptualized ways to leverage our platform, and as a best practice, we recognize that as organizations can start to bring the story together, bring the data points together, not only does it become easier to manage, both from a relationship and a data flow perspective, there's a lot more learning an organization can do. We can dig deeper into the measures and we can understand the influence and the impact. We can also have some congruence around the way that we report, we talk about, we strategize the actions that we take based on this information. And part of that begins with where and how we capture the patient experience journey. So I mentioned up front, when the patient is visiting your website and thinking about seeking care or making determinations around where they want to take their family and friends and loved ones for care. We have web intercept capabilities up front, the ability to engage with a patient up front in that decision process, understand whether they're getting the information they need, and engage with them in that context. On the other side of the spectrum, we have patient portals, and we have opportunities within places like MyChart to embed surveys or to embed capabilities for feedback when they've become a patient and when they are already in your system or using your portal to find health information, to update records, so on and so forth. But in between, we've got lots of different strategies and lots of ways we can both collect data and leverage technology to enable the patient and, in certain cases, the employee to provide feedback. Bringing in social media and analyzing that adjacent to patient experience data ramps up and expands the breadth of data you can look at and the impact that your patient experience program may have. We know that not every patient is given the chance to provide feedback, as most organizations sample patients. So social media is, again, another way to understand from text analytics or from other type of data how patients are reacting to the care they received. And it's important that this data be brought in and analyzed at the same time post-care feedback survey data is analyzed. We also can use dynamically text and thinking about ways to leverage the technology that's in the hand of the respondent almost the entire time that they're there with a loved one or that they are moving through the journey to seek care. And we've got unique capabilities to leverage this technology to present a survey, not just a survey invitation via text, but leverage text as a mechanism to communicate with patients and give them some real-time opportunity for feedback. QR code in waiting areas or in posters where we can dynamically invite a patient or a loved one to provide feedback and give them the option to scan and now have metrics associated with a physical place. And this is a great way, again, to leverage the technology in the hand of the patient or the respondent, but attribute results in the appropriate area, and also think about service recovery mechanisms that we might be able to take based on real-time data and dashboards associated with this feedback. Tablet and kiosk, not uncommon and perhaps less growing as we think about QR code and dynamic text and other methodologies to leverage hardware in the hand of a respondent, but certainly embraced within the industry and it has its place. Video and audio, a newer modality, and thinking about ways we can embrace the younger generation who wants to provide either through social media or in a feedback mechanism, a video of their experience. They literally want to and prefer to many times narrate a story about what happened to them or what happened to their family member. And considering ways we leverage that to blur and use facial recognition to capture emotion, but not violate PHI and take into consideration the sensitivity of collection. Those are protocols and modes we make available. Of course, mobile optimized. Again, thinking about ways that surveys reflect in a device versus on a screen, and having to have a system that operates that function for us, not having to redesign or recreate every time we spin up a survey or create a measurement. Leveraging online and email, which we know is a capability today, but where we can also get more sophisticated in branching logic. And then, of course, postal mail. And diminishing the extent to which we need slower modes or more costly modes like mail, and bringing up to speed more tech-driven capability and real-time opportunity for data. I've brought up on screen here a couple of visuals of the ways in which we can support and offer dynamic text capability. And these examples relate more to how we engage a patient with specific needs as they may proactively approach us, or as they come in and are admitted and check in, ways in which we can engage with them right away. Again, given that we collect phone number at the time of admit. And so as you can see on screen, these aren't just invitations to respond to something. These are dynamic in nature, they're visual on the screen, and they're much more robust than a traditional link that we might see in a text survey or in an invitation. The same concept and the same design and tailoring goes into any kind of online survey. And a best practice certainly is that we leverage the look and feel of the areas, the visual cues, the providers, if we know them or if we're measuring at a provider level, and that we personalize the surveys to think how much more deeply we can connect that respondent to their experience and also to what we're trying to measure. We have opportunities not just to replace a logo or leverage a paper survey that has been put online with a branding, but to get much deeper in terms of a fully customizable look and feel of a survey with, again, unique text, unique built-in capability and personalization, and even technologies and best practices like Quick Start, which enable an item to be presented up front that when clicked digs deeper into follow-up items, or, as I mentioned, uses branching logic to think about different ways to follow the journey and understand really what happened and why scores are what they are. I want to think for a moment about HCAHPS and the process of HCAHPS. In the patient experience industry for many years, we know that HCAHPS was designed initially as a benchmarking tool and a public reporting tool, not necessarily an improvement tool. And one of the traditional ways around that has been to add additional items, proprietary items by a vendor in particular, to the end of an HCAHPS survey and collect more relevant information or more specific feedback around the concepts and the domains that HCAHPS measures. When we're doing this by paper or by phone, as required, we're very limited. We're limited in time, we're limited in space, and I know that many organizations out there listening in today have made intentional decisions to pare down their CAHPS measurement, maybe more exclusively or solely utilize the CAHPS survey and diminish the use of any extraneous or supplemental items. When we have a sample and we have to follow a CAHPS process, those limitations are in place. But where we've got an additional sample, or if we minimize the percent of patients for whom we are following the prescribed process, and we maximize the use of technology and online surveying capability, we can, for example, take an HCAHPS survey, issue it to a patient who is not part of the CAHPS sample protocol, and build in branching logic to have the survey follow some of the unique response and dynamics associated with that patient's feedback. So when a patient initially says that a provider didn't communicate well, we can dig into why, and we can more dynamically follow that branch of thinking and that particular aspect and not have to utilize all of the items in the order in which they would be presented on a paper survey or in phone per the protocol. That, of course, includes Siri-enabled with Apple devices. It includes Alexa. It includes video and audio, where we also know we have the ability to get more open-ended feedback, more stories, and subsequently more data that we can analyze via text. And we can get much deeper in terms of what we can learn and the story that is shared by the patient against which we can take action. One of the other critical elements is when we get feedback, in what way can we dynamically promote getting additional feedback, in particular focusing a response and a patient to share more about their experience and their comment. Many surveys have sections where they offer an opportunity based on a theme or a category to provide a comment. And oftentimes I think what we see is a very short comment, if even one at all. Here's an example where a patient might say, my doctor didn't communicate well. And while that's important to know, and it's probably top of mind for this particular patient, it isn't terribly helpful for us to know what to do differently or in what way the provider did not communicate well. SmartProbe is a technology that is offered with online surveys to dynamically understand whether a comment is provided, and if it is not, to prompt the respondent to do so, whether a comment is too short and in nature doesn't provide enough detail based on word count to be perhaps helpful, or based on themes, keywords or themes and phrases that the organization has decided to embed in the technology to prompt the respondent to dig deeper. So an example might be, instead of getting "my doctor didn't communicate well," the organization might get "my doctor didn't communicate well to help me understand the follow-up plan of care following my surgery." That's very different now to be able to react to coach providers on, or to generate action plans on, in terms of how we communicate and in what ways we can address this patient's feedback, as well as the theme itself across open-ended constructs of data. Now, there are lots of you out there, and lots of organizations certainly say, well, how, if I am embedded with a particular provider, or my budget is maximized in terms of the surveys that I send, how can I take advantage of different tools, technology? One of the methods to this is to think about the breadth of your program and the way in which the organization spends money, in particular on volume and on modes like paper surveys that are more costly, or phone surveys that are more costly. In what ways could an organization continue, for example, a CAHPS survey process with an incumbent vendor or a current vendor, leverage benchmarking to the extent that it's provided, but decrease the volume associated with some of those proprietary surveys and the subsequent cost, and add additional technologies, including some best practices, but also taking that data and moving it into a platform that lets you analyze it adjacent to other information and other data. And this is one mechanism where organizations can start to leverage new tools, new technologies, means to reach out to patients to collect feedback, and also analytics and reporting to understand the outcomes. Let me talk for a minute about employees in healthcare, and in particular the importance of employee engagement and the insights that employees and providers provide. As I do, I recognize that many organizations, just as they do outside of the healthcare space, do not regularly measure employee experience, and in fact may do so on an annual basis, or may do so every 2 or 3 years. Organizations that embrace a more open listening strategy and techniques to allow employees to provide feedback in real time, and as events occur or as experiences are changed or shaped, have an opportunity to react in real time, but also prove back to their employee base that they're listening to feedback and actually using it to change patient outcomes, employee experience, and even the operational aspects and components of the business. The patient experience, as we know, especially for most of you listening in today, is really the tip of the iceberg. It's very visual. It's well funded traditionally. It is at the desk and on the minds of most, if not all, executive leaders, and it is very prevalent in the industry as a topic, and certainly a core one for us to measure and better understand. But most everything that impacts that patient and shapes that experience below the line or below the water in the iceberg reference relates to the people in your organization. And their communication and awareness around your program, your objectives as they interact with patients or as they support one another, as they go through training, and also as they impact the culture of the organization, which really is the foundation of who you are and what you do in your community. We have opportunities with pulse surveys and also leveraging the same platform, same mechanisms and technologies that we have for surveys to capture feedback from employees as events occur, to understand that impact in real time, and to take action in terms of awareness and training where we see it's necessary. That may relate to safety, it may relate to operations. It may just relate to a theme that we understand from patient survey data over time. But we can take action in a more nimble way. And again, we can prove back to employees that their voice matters. We also know that understanding a healthcare employee's voice and their experience in healthcare is not like other industries. It is not one-to-one. And there are companies that will say, well, we've got a model for engagement, we've got a model for understanding employee experience, and it spans the continuum of different industries. And while that can be effective and it can promote benchmarking and it can help an organization understand engagement at large, these concepts on screen make the healthcare employee's journey and their experience very different. First and foremost, employees almost always of a health system or a hospital are also recurring patients. One of their benefits is medical care provided by the organization that is their employer. And so they have a unique perspective as being both patient and provider, if you will, of the care. We also know that their feedback and typically that they are employees of the largest employer in their community or workforce. Maybe not true in some of the major metropolitan areas, but certainly in many communities, a hospital or healthcare system is the largest employer. And so it touches the lives of the majority of the workforce in a community. We also know that employees can shape patient expectations by word of mouth. The way they share their job, what they do day in and day out, the operations, the inner workings of the organization with their friends and their family outside of the walls of the medical center have a huge influence on patient expectations and on the way a patient will perceive care before, during, and after their experience. Feedback in this realm can also save lives. It isn't feedback that helps us better promote a product or a service, better position it for a buyer necessarily. This is life and death, and quality here matters. Understanding, each insight, each critical thing that an employee might understand differently than a patient respondent or other can make a huge difference internally. The real-time voice of the employee improving the patient in the moment. Again, thinking about the tools, the techniques, the ways we can empower employees to share ideas but also take action has an immediate impact. And that, as we know, healthcare staff are around-the-clock resource to the community. There's never really an off switch for this, and I'm, a personal. I'm guilty of this as well. And we think about, friends and family and loved ones, and having people that we know work in the medical field. Oftentimes, we call them first. We send them a picture. We say, "What would you do in this situation?" It could be related to my child. It could be my own healthcare. It could be another member of the family, but we're regularly seeking feedback and insight from those who work within healthcare. And so those concepts need to be understood. They need to be measured. They need to be part of the employee journey. But also, we have an opportunity with employees to dig a little bit deeper into their insight and their experience in providing an exceptional care treatment plan or path to the patient. And as PX leaders, we have expectations of our employees. We know the right things to do, and we may do training with employees on those measures. But seldom do we go back out, either through an employee survey process or as PX leaders more selfishly to understand a little bit deeper about the impact on the outcomes for patients. Things like these. To what extent do processes and procedures limit an employee's ability to feel like they can provide exceptional care or experience to a patient? Are there incentives? Do employees benefit in some way from going above and beyond or changing the patient experience? Is there good consistency? In what ways do they leverage technology or are hindered by technology in this path? Do they understand patient expectations? Do they understand or even have visibility into the reporting as it relates to feedback that we get from patients? And also things like goals. Do they understand their goals? In what ways can we further share and promote that in the organization and across upstream and downstream? In other ways, in addition to that, we also have an opportunity as we collect suggestions and feedback from employees to report it and overlay patient scores as it relates to similar themes or the same concepts. So when employees talk about shift change, when they have comments about provider communication, safety, rounding processes, teamwork, breaks, tools, these are concepts that patients also pick up on, also may have feedback on, and affect both the internal and external patient. And we can leverage the same platform and technology, as I mentioned, to overlay, further analyze the data in one place and start to understand where do we have continuity in what employees are saying and what patients are saying, but also where do patients and in what ways are their experiences most influenced by the themes that they provide in an open-ended comment? And again, how do those relate to improvement ideas that employees may have? Being able to look at this in one place and generate those kind of analytics is also very powerful. And with that, as I close into this last section for our time today, I want to talk for a few minutes about effective dashboards and reports. One of the things that I see all the time is, as I mentioned when we opened, organizations having to create their own scorecards, leveraging their own unique process or the way in which their leaders want to see results. And I think more often than not, that happens because any one vendor's data or reporting portal doesn't allow for the flexibility, doesn't allow for the customization that the organization demands. One of the ways we try to break the mold of that at MaritzCX is to create and enable the personalizations and the drop and drag customization to reflect more dashboards and more unique displays of data, but also governance around the way that an organization uses them. Where we can analyze data in one place, we can bring in data sets that aren't limited to just patient experience feedback. We can bring in revenue, we can bring in operations data. We can know nurse-to-patient ratio information adjacent to patient experience outcomes as provided by patient surveys. We can dictate better control of that data, who sees what, how we push reports, and of course schedule reports as we have the capability to do, but also provide analysts with deeper tools to dig in, understand correlations, and be mining for unique findings rather than having to spend time recreating a report and pushing out a report. And so with that, as we think about our organization's top leadership, as we think about our board of executives, as we think about the C-suite and what they're looking at, of course we have the opportunity in dashboarding to create the high-level goals and metrics dictated and governed by the organization. And we need good visibility and good displays of that information because that's what we look at all the time. Those are the ways as an organization we deem and determine our success. But as you think about a traditional dashboard and you follow things like leadership, quality of care, outcomes, actions, development, you need to then say, now what? I've got the goal, I've got a way I can visualize the outcome, but I also need the drivers. I need the system to analytically and dynamically tell me what to work on and what to do next. And that's where concepts like true driver analysis and over time displays of data help us dig a little deeper, help us articulate the order in which we should work on things, and then have subsequent dashboards, drill-ins, and access to the supportive data and the information that helps us understand whether operationally we're taking those actions and whether we're following through with the things that we know statistically we should do or that we've determined we want to do. Dashboards also are more powerful when they're organized in a way that reflect the viewer. And an analyst and his or her view of the data should not be the same as an end user or a unit manager or someone doing rounds and a nurse rounding dashboard at a nursing station. And so dashboards can create visuals, can leverage a look and feel that reflects the process. This is one example where we have an embedded floor print of a wing or of an area, a floor of the medical center. And with rounds, we can think about the score overlays and the ways different areas score and report over time. We can create different quadrants. We can create unique ways that we want to reflect that data. And it's designed, again, with the user in mind, customizable with drop and drag functionality. We also have unit dashboards where we can combine data over time. We can have indicators, of course, that tell us statistically if we're moving up, down. We have over time charts, run charts, control charts, but we can embed root cause of problems. We can embed additional research that we do outside of the platform and leverage in the platform and use for display or for process change. We can even include rounding data adjacent to other kinds of information, as I mentioned before. Action planning is another major function, and it's one that oftentimes is not personalized to the organization. Better action tools are ones where the organization can say, we've determined, or we want guidance in determining, the right kinds of focus and the right outlay for how we engage in the process of taking action. Not just document what we're doing, but also how we document that. And this is one example where a client has said, we've got a MaritzCX program. We're going to follow the engagement driver model that we embed, that we've established as an organization. We're going to document root causes of issues, have employee-driven proposed solutions that have approvals and can be managed upstream and downstream, but also document what's done so that we can go back out to the organization and say, here's what worked, here's what didn't, here's what we're working on, here's also the time to resolution, the time for completion on the action plans that we put in place. And this also allows employees to be part of that process. Many times as they share insights and ideas, employees want the opportunity to see their idea through and take action on it. And we can give them that control. We can at least give them an opportunity to track what they're doing and empower them to do the things they know to do across the organization to improve. And finally, looking at all of the different aspects and having a means within one dashboard to follow a journey or follow different kinds of data sets. This is one where we might look at the overall patient experience, but we might say there are lots of different components, as I showed, upfront, in the moment, in real time for service recovery, after they've been discharged, even as community members at large. And how do all of those surveys, how do all the data points from them compare? What common measures do we have that span them? Where might we invest more time or effort? Or in which areas are we lower or higher performing? This is easy to do when you've got a platform or a system that can enable that different kind of data collection and also that different kind of display information. And so I go back to this slide as I close before I open it up for Q&A. And I think again about organizations that have some unique conditions for which they're trying to solve. One may be that there are lots of people internally that want their own survey, or they want to be able to measure something unique that can't be added to the existing patient survey. The enterprise level hub or the enterprise level platform allows for templates and continuity of the way those surveys might be generated, so that organizational users don't have to go out to a place like SurveyMonkey, create their own survey, and sort of combat what the organization has decided is their branded, governed survey process, which we know happens all the time. We know, again, as we think about leveraging more dynamic tools, branching logic, getting deeper into the experience and using technology, we can save costs, but we can also better understand, what are some of the true themes, the deeper dives of information we need to learn to make change. Seeing and having a window into the collection process is really important. Oftentimes it's overlooked in a particular vendor's tool, certainly something that is critical to the process. And finally, as I mentioned, cross-analysis, digging deeper, understanding the influence of different data sets, and being able to represent them within a dashboard over time. And with that, I'd like to, again, thank everyone for participating. And Melissa, I'll turn it over to you to open for questions.
Great, thanks, Jason. Definitely an exciting time to be in healthcare and see how technology and healthcare are working together. So thanks for the information. We did have some questions come in, so we'll just kick those off. So the first question is, do people incorporate NPS or Net Promoter Score into their surveys?
I think that's a great question. Certainly the answer is yes. And we know that some organizations may or may not leverage Net Promoter Score now, in particular because most of the traditional vendors and those surveys, even including the CAP surveys, may not necessarily leverage the NPS methodology. Because our platform, for example, is not tied to or hard-coded to a survey, a scale, or any predetermined items, though we have recommended items to use, we can embrace NPS. And we can think about not just alternate scales and alternate types of items, but even the ways in which patients could measure them, different drop and drag functions in a survey, ordering of things of importance, drag functions with different kinds of response category capability. So I would challenge folks to think about ways they could leverage the technology to do those things, not just with NPS. But I think that's a great question, and certainly one that can be supported.
Great. The next question is, what are the most impactful components of a patient experience program?
Well, I think some of the more impactful components, again, relate to, and I go back to this slide, they relate to meeting the patient where they are, and also understanding how each unique experience matters to a patient. I think oftentimes we are relying on that post-visit or post-experience survey to try to collect everything, and we're not thinking about all these other things that happen even before the patient came for care. I think many times we're also not thinking about the journey. We're not thinking about, leveraging a unique set of items that might come from knowing where that patient was or even the kinds of treatment that patient received. And that level of dynamic capability is impactful on a PX program if it's used. I think the industry has not as widely embraced the capability or not allowed for that level of dynamic function. And so we can break that. We can use information more dynamically. We can have sections of surveys that are dedicated as placeholders for unique items if they're experienced, if we know the patient passed through or had those care treatment plans. And where they didn't, we don't need to waste space on the survey or leverage a pre-printed function to try to ask if they had it or not, if skip to this section. So those are impactful things that I would challenge PX leaders to think about, and they can have an enormous impact on what the organization can learn from the patient.
Okay. Next question is, our health system has a few analysts that help me support our PX program. What new or different things should analysts be looking for?
That's a great question. And I would say for those of you that have team members and have support around you to be able to analyze and understand the data differently, use those resources as best you can, not to rerun reports if you can avoid it, but to allow those analysts to do what they love to do, which is dig into the data and learn new things. We've got lots, and there are in the industry, lots of additional tools and techniques to understand correlation, to understand the variables, again, mapped by different conditions, by time, by the journey. So one example is, we can look at clinical files. We can understand based on clinical outcomes how those might correlate or correspond with different patient outcomes. That can be analyzed and done within the platform, where we can bring in operational data. We can bring in ratio data. We can start to see that broader story. We can dig into some of the effects that certain conditions may have. Even if I get specific with the answer, if we were able to know, when a patient calls for assistance or has a question about their bill, they are 2 times or 3 times more likely not to be a promoter or not to recommend the organization. We have tools that allow us to know those very specific things. And I think it gives an analyst, for lack of a better term, more of a sandbox in which to play, in which to understand data and learn on behalf of their organization so that different actions can be taken. So that was a long answer, but I think analysts are looking for those tools, and I think certainly we know they're out there. We know we offer them, but they may be less regularly used.
Great, thank you. Can your platform create dashboards to follow programs such as MIPS or Magnet?
Certainly. So going back to different displays of data, the dashboards can definitely represent different processes. They can represent the variables associated with MIPS and different programs. If your organization is one that is on the Magnet journey and going through Magnet certification, We may bring data in, different data sources, and we may be able to represent that across and see that in one dashboard and reflect some of those components. So yes, the system is very flexible. It essentially begins as a blank page. You design it, we design it on your behalf, but the capability exists to follow, unique processes, unique requirements, and different displays that connect.
Okay, and the next question is, what is the best approach for using different survey modes?
Well, I think the survey modes, again, need to be governed. And one of the important things is that you think about the protocols associated with them and having the platform help you understand, where and when to provide the option to a patient for response. Thinking about the slide that has the different modalities on it, where we can engage with the patient in different ways, there are lots of opportunities to do this. And it doesn't mean that an organization has to leverage each of them. But where we know we can get better insight from some of these aspects versus others, and start to pull in data, I think that's important. I think at the end of the day, patients should have choices. And in particular, use the mechanism that they prefer. So younger patients may prefer more tech-savvy video, audio options. Other patients may not. If we give them options, we have a better chance of getting their insight.
Great. How do we promote positive employee contributions on patient experience outcomes?
I think that's a great question, in part because I like the thinking about the employee side and the connection, the influence that it has on patients. As I mentioned, I think making sure you share with employees that you've heard them, that you've collected their stories. Oftentimes when leaders go back out, they share what an employee has done to shape a patient's experience in a positive way. And it can be a net of one. It can be one example. That goes a huge way with the employee base. I think the other is giving them the tools and bringing their ideas into action plans. And where they've got insight, tracking those against what patients say, validating what their concerns or their ideas, and making sure that their voice is part of the equation on the PX side, not just from an HR perspective. I think that's how you promote their positive contributions the best.
Great, thank you. We are at the end of our time, so if you had questions that weren't asked or answered today, we will follow up on those, or feel free to reach out to Jason directly as well. Thank you, Jason, for the presentation, and all of the attendees for joining today. And with that, we're going to close the webcast. Thanks again for your time, and have a great remainder of your day.